Good morning, good afternoon, good evening. Welcome to this webinar today, Compliance Conversations, Virtual Activities, and Returning to the Field. I'm very pleased to welcome Sergio Alegre and Seth Lundy as panelists for this webinar today. We have a lot to cover in this hour, so I'll just keep the introductions really short and really quick, as there's going to be a lot of content that I think will drive the value for this webinar. I do see folks still joining in. As you join in, I think we'll, because we want to keep it on time, we would have gotten started. But as you join in, if there's questions or things you want to ask, there's a questions box and a chat box you can ask in there. So just quick introduction to our panelists today. Sergio Alegre is a VP of Global Compliance at Osmotica Pharmaceuticals, and he's been a customer of Core Data for many years now. We really enjoy working with him. He's been a great supporter and help. I'll go through the introductions and bios quickly, and then Sergio and Seth, if you want to add anything, feel free to chime in as well. So prior to Osmotica, Sergio worked as compliance officer for a variety of different pharmaceutical companies, and he has practiced as an attorney with both large law firms as well as in-house at Fortune 500 companies as well. Welcome, Sergio. Very pleased to have you on this webinar. Okay, I'll move over to.
I don't have anything to add other than we have been working for many years and hope to continue working with you and your fine team for many more.
Okay, thank you so much, Sergio. Fantastic. And Seth this is the first time for Seth to join one of our webinars, but very pleased to have another one with King & Spalding. As you know, King & Spalding is a brand name in the space of law, and specifically in the space of pharma and medical device law. And Seth is a partner at King & Spalding, and a couple of decades or more working with complex legal and regulatory matters as it concerns with medical device, pharmaceuticals, biotech, and healthcare providers. He's a deputy chair of FDA and life sciences practice at King & Spalding, and he's recognized as a national authority. I've seen him speak a few times, and I'm very honored to have Seth in our conversation today. Welcome, Seth.
Thanks for having me, Mohammed.
Fantastic. Okay, just a quick word about myself. Of course, I'm CEO and founder at Core Data, and last few years, almost 5 years, working with the team to build out a compliance platform for pharma and device companies. So a lot of learnings over this period, but very grateful to have over 30 different pharma and device companies that we call our customers and part of the Core Data family. Just a quick run through of housekeeping items. You can ask your questions via the panel on GoToWebinar. There is a Q&A section as well as a chat box. We'll monitor both of those. Do fill in when you have a question or want to chime in. Again, this is a legal disclaimer. The views and opinions expressed by the speakers are their own and do not necessarily reflect the official position or policy of the companies that they represent. We'll record the webinar. The lines are going to stay muted. Slides are copyrighted, but can be used without attribution. We will publish a recording of the webinar at the end for those that were not able to attend. And if you do need any urgent help, there's a number here, 832-519-1365, that we can provide help as if you have any challenges with the technology or anything like that. So just a quick run through of the agenda. We'll cover compliance in the current pandemic, virtual interactions with HCPs, and then I think one of the key topics that's coming out more prominently is how does the field force go back into the field. So we'll cover a lot of that with a lot of good examples. And Seth is going to run through what the legal implications are, and Sergio is going to talk a little bit about how they're handling that at Osmotica. So we'll get both sides of the spectrum, and we'll leave some time for Q&A at the end. But before we get started, just a couple of quick polling questions. As your field force engages in virtual activities, how nervous are you? So I've left it as engages, meaning that I'm not asking the question whether they are or not. It's an assumption that almost every field force that at least we know of as engaged in some sort of virtual activities these days. So I'm going to launch the poll. Ravish, can you help me launch the poll? It looks like I lost my cursor somewhere. Yes, I have to do. Okay, I got it back. All right, I should be able to launch it. All right, so there should be a poll on people's screen. If you can vote quickly. As your field force engages in virtual activities, how nervous are you? Very, just a bit more than usual, it's business as usual, or not worried at all. We've gotten about half the responses, so I'll keep it for another 30 seconds or so. We can get a quick response. About 70% of the folks have responded, maybe another 10 seconds. This is an interesting one just to gauge how compliance feels when the field goes back, when the field force is engaging in virtual activities. Okay, I think we have enough votes, so I'll publish the results, closing the poll out, sharing the results. Hopefully everyone can see it on the screen. For about 10% folks, it's business as usual. 70% are a bit more nervous than before, and 20% people are very nervous. And it goes to suggest that this topic is relevant, important, and critical for the teams in compliance. With that, I'll follow up with one more question before we go into the actual presentation. So what are the biggest challenges for your company as you move towards virtual interactions? And this is going to be a multiple select, so you can select more than one if you'd like. But this was an important, interesting one in the last webinar when we talked a lot about IT support and technology as kind of the driver for some of these challenges where, having to train everyone on how to use these tools and then really being able to make them effective while pursuing and ensuring compliance controls are in place. So I have about half the respondents have voted. I'll give maybe another 15 seconds or so we get a good polling, and then we'll close out the poll, show you the results, and then move to transition over to Seth for the rest of the presentation. So another 5 seconds or so. If you haven't voted, I would love to get your input in there. Okay. All right, I'm going to close out the poll and publish the results so we can see it quickly. Okay, and looks like almost all of these areas are challenges as we go through virtual. I think the biggest concern seems to be around rules of engagement, which basically means what the compliance procedures and policies are going to be, how we're going to ensure all the things that we used to ensure in physical interactions are still maintained, and then of course regulatory environment. Folks have voted for technology and IT support, and then training. Thank you for that feedback. I'll hand this over at this point to Seth to take us through the rest of the conversation. So I'm going to make you the presenter, Seth, and here you go. You should get the presentation right, and you should be able to share. We can see your screen, Seth.
Great. Thank you, Mohammed. So as Mohammed indicated, we're going to look at both concepts here in terms of what's going on now with what manufacturers and companies are doing just generally in the current pandemic landscape, focusing mostly today on where we're at with most companies, which is virtual interactions. But at least at King & Spalding, we're dealing with many companies right now that are in the midst of trying to figure out how to re-engage the field force. And in some cases, that's been going in fits and starts right now, as it looked like the world was about to open until a couple of days ago, and now maybe not so much. And that is really something that's just indicative of this entire landscape that we're dealing with in a pandemic, which is there's just not a lot of certainty. And what we know today may not be the same as what we're looking at tomorrow. So we're going to raise those issues, and feel free, as Mohammed indicated, to be able to ask questions through the Q&A or chat, and we'll try to address them either during the presentation or at the end. In terms of looking at the current landscape and where we're at, I want to focus a little bit on just sort of what's out there, what we're seeing, but really through a lens, in particularly when we talk about virtual interactions, looking at the existing legal and compliance guidance that's out there, predominantly the pharma and AdvaMed codes that give a lot of guidance in terms of interactions with HCPs, but never really contemplated an environment like the one we're living in. So, as many of you indicated that you are a bit more nervous than usual about compliance in this situation, you're not alone. And pandemics are certainly not for the meek. There are more questions than there are answers, and therefore everyone's going to love a compliance and a legal person if you're able to come forward and provide positive answers to be able to move your organizations forward. And that's because what we're really seeing right now in this current landscape is, if you haven't noticed, a general lack of guidance out there, just about at every level. Just earlier this morning, Dr. Fauci was testifying before Congress, providing information, as was the director of the CDC, providing information that is often incongruent with what you're hearing from other leaders, both at the federal and state levels, as well as localities, mayors, governors differing with one another in terms of opinions, rules, orders, and quite frankly, all of those having to also be viewed in the wake of what your customers are doing and seeing, as well as, frankly, the world of patients. Even if a doctor's office is open, is a patient willing to come in and seek care? And if they are, what are the rules of engagement going to be in that type of condition? So we're seeing variation across the board. And most importantly for us in the life sciences space, no one that we've been tracking is really focused on what it means to be a life sciences company providing essential solutions to patients in healthcare situations when they're coming out with global, national, regional, state, and local types of guidance and ordinances. And they're focused more on the broader economy. And frankly, if you're trying to open a barber shop, you may have more specific guidance than if you're trying to actually run a pharmaceutical company. And this is creating lots of different challenges, as is the fact that many of our customers, as I said, are making their own decisions about when and how to operate and what the rules of engagement will be. And as I think Mohammed's poll indicated from the beginning here, one of the other things we're seeing is people's own confidence in terms of what they're doing is varying in terms of the level and degree of risk that you're seeing, both as an individual and as a company. And in part, that's because there are different challenges with being able to see around the corner here in terms of what the likely impact is of decisions or indecisions in this type of environment. So we're going to talk a little bit all about those issues today and give you some insights as to how they provide some impact both in a virtual and some type of return to work environment. So first, as I indicated, if we look for guidance in terms of what we're going to talk about today, predominantly interactions with healthcare professionals, the beginning and the end is often with the industry trade association codes of ethics on interactions with healthcare professionals. And as most of you are likely aware, both pharma for the pharmaceutical and biotech industry and AdvaMed for the medical technology industry issued relatively around the same time codes of ethics on interactions with healthcare professionals. And I raise these because the most important statute when we're talking about interactions between manufacturers and anyone that's frankly in a position to be able to generate federal or state reimbursed healthcare services, which can include healthcare providers, healthcare professionals, even patients, and in a number of instances, third-party organizations, whether they be hubs, PBMs, insurers, distributors, or otherwise. The codes are really a gateway to being able to look at what the law is. And the predominant law is the federal anti-kickback statute, which prohibits broadly any type of payment or remuneration of any type, whether it's in-kind services, free items, discounts, or certainly various forms of payment, if even one purpose of the statute would be in return for generating federal or state healthcare program business. It's an extraordinarily broad criminal statute with very few standards built in outside of the safe harbor protections. And this is where the Pharma and AdvaMed codes came in, which is sought to identify normal, traditional types of activities that, if left on their own, may not fall within a safe harbor or protection under the anti-kickback statute, but quite frankly, are the types of things that industry believes and should believe aren't the types of things that should implicate or create a criminal violation of the statute. So what the codes then set forth to do was to enumerate certain common types of activities that companies and their personnel would undertake, such as detailing, having lunch and learns, entering into consulting arrangements, etc., wherein some form of benefit would typically be provided to a healthcare professional or organization, and to identify them as the types of arrangements that wouldn't violate the statute, even though technically such arrangements may in fact violate the statute and from a legal perspective. And the reason that the codes are able to have an impact is because the anti-kickback statute is a criminal statute, is intent-based. And that means that typically the government has the burden of showing that a company or an individual had the requisite level of intent to violate the statute, not just that they undertook specific activities that fall within the broad scope of the statute. So by complying with the Pharma or AdvaMed code to its letter, a company or an individual can fairly represent that they wouldn't have had the intent to violate the criminal federal statute because they were adhering to longstanding industry guidance that they understood to be intended to help comply with the law. But again, as this slide indicates, it's important to remember that compliance just with the code is not necessarily compliance with the law. For that reason, AdvaMed last month came out with some supplemental guidance to its own code of ethics, which was intended to help sort of stretch the guidance and provide it in a little bit more of a pandemic perspective. The code can be found at the website here, identified on the site, or you can Google it as well. It's all publicly available. And ultimately, there's two directions that AdvaMed goes. One is the conservative direction, which is, I think, sort of a good thing to set the tone for today, which is simply from a compliance perspective, just declaring, oh, it's different now because there's a pandemic, has no force of defense under the law. And so while there may be some indications with intent by looking at things that have changed under the pandemic, it is not necessarily a fallback that will win the day in 1 or 2 or 3 or 4 years from now when enforcement authorities are looking at the activities that are being conducted today. And AdvaMed, being savvy of that, is advising its members specifically of that. At the same time, it is trying to identify certain situations that are going to be unique in the pandemic, such as various forms of virtual education, whether through detailing or training and education events, as well as a propensity that organizations may have to want to provide donations, potentially even to customers that are going to be helping out significantly with the pandemic. So the AdvaMed code really tries to stay within those two boxes of potential areas where its code may be stretched a little bit, to provide additional guidance. Pharma, on the other hand, has been considering these same types of issues, but has yet to provide any specific guidance and or determine, in fact, whether it will actually provide such guidance. As of yet, we haven't seen any other information coming out from other trade associations relevant specifically to the life sciences industry, although there have been some from the American Hospital Association and other provider organizations that may be advising many of your customers. And instead, in this lack of guidance sort of world, what we're really seeing is many companies acting off of either the types of benchmarking that we started with today, or in some cases, more informal benchmarking, which is what they understand from the field or from personnel about competitors doing in the marketplace. And again, I think in many ways, from what we're seeing, working with over 200 different manufacturers, some of that benchmarking may be off, and assumptions may not always be reality in terms of what your peers and competitors are doing. So be mindful, and again, we suggest considering the AdvaMed cautions about what is being done in a pandemic situation this way. With that in mind, we're going to turn over and talk a little bit about specifically how that guidance impacts and how the pharma and AdvaMed code impact what companies are or may be doing with regard to virtual interactions, where quite frankly today it's just not possible in many states and locales to have sales representatives or MSLs or other personnel going in and interacting in person with healthcare professionals. So let me turn it over to Sergio to talk a little bit about virtual detailing.
Thanks, Seth. You're getting back to your last slide when you talked about informal benchmarking and what companies are doing. What I'm about to talk about is mostly what we're doing at Osmotica. I will sprinkle in some of what I've heard in my informal benchmarking when I've reached out to colleagues at other companies, compliance consulting companies, whether it's Coordinator or others, even in discussions with some of the outside counsel that we've engaged prior to launching our virtual interaction. We call them VPEs, Virtual Professional Education. So if you hear me say that, that's what I'm referring to. I might revert to that term. So what we're going to talk about is virtual detailing, lunch and learns, speaker programs, ad boards, MSL interactions, kind of the gamut of some of the things that companies are doing. We at Osmotica are doing all of that, but quite a bit of it. So the big picture is that these virtual interactions are really supposed to be substitutes for in-person interactions. That's really the only reason why we're doing them, is because we cannot do an in-person interaction. So when we launched this, I told our sales reps, if you had offices that were categorized as no-see offices where they don't see sales reps, so this is not an opportunity for you then to reach out to them and offer them a virtual lunch. This is where you have a situation that the office is closed due to the pandemic, and there really is no other way to remind the physician about our product and train the office about the use of our product, et cetera. That's really the only reason that it's for. So it has to have the same focus and intent as an in-person interaction. The meal cannot be secondary. The meal must be the primary. The meal must be secondary. The meal cannot be the primary purpose of the event. This is not a, thanks for biting our product. Thanks for, staying open. This really is all about the office is seeing patients. So there's a physician and some staff there. We as sales reps are barred from going there live. So we are going to be able to do something virtually to mimic what would have been done in person, but for the pandemic. Full stop, that's what we're training our reps to. There's nothing different about the interaction other than it's going to happen via Zoom. There are some, minor things that we've got to do in terms of, documentation and how things are going to work from an operational standpoint. The big picture, it's
And I want to just tie that back, what Sergio is explaining back again to the Farm and AdMed code issues here, which is what we're saying is with respect to there being any type of remuneration or benefits that are transferring from the company to healthcare professionals, the underlying basis for that has to be the same as it was in any circumstance before the pandemic. And most significantly, that includes all of the promotional requirements that are still in place from the Food and Drug Administration, but also with respect to things like meals and other types of benefits that may be conferred. But that's different. The benefits are different than the subject matter itself, which certainly you could always provide virtual education if there was nothing else attached to it and it was compliant with all of the Food, Drug, and Cosmetic Act rules and requirements regarding promotion of your product. So we want to separate out the actual educational component from the transfer of value, if you will, to use a Sunshine Act type of term that relates to in-person versus virtual. And we'll get at a bunch of these as we go through.
Sergio, your audio quality, some folks are suggesting audio quality might be a little off. I don't know if you can speak a little closer to the mic, Sergio.
Is this any better?
Yeah, it seems to be better.
All right. I'm trying to use my headset for better audio quality. So if it doesn't improve, I'll use the computer. I'd rather not do.
Okay. This is better.
All right, good. So here are some best practices when you're conducting these types of interactions. First, you've got to decide what platform you're going to use for the event. We could use Zoom, WebEx, you could use FaceTime, you could use, pick one, work with your IT department, make sure that your sales reps have been trained on how to use the technology, but pick one and that's the one you're going to use. Now, bear in mind, the office may have issues with the technology the day of the event, may not know how to use it, or may have a strong preference to use a different platform, meaning that you have to either decide to use the platform that your company has chosen or the office one. So we always say have a plan B or backup. If there is an issue with the technology you've chosen, then go to FaceTime. Do something different. As long as you can follow all of the rules that we've set forth, we're kind of platform agnostic, but for the fact that we've had to choose one. Then what we do is we ask the rep to contact the office and to appoint one person in that office as the primary contact who's going to be responsible for everything, including the technology. So what we say is have a call in the morning. We typically do lunches, although you could do a breakfast. There's no reason why you couldn't. Have a call in the morning with the contact person and ensure that they are able to use the technology, let's say it's Zoom or WebEx, log in to a morning call using the technology, ensure that it's working and that they'll be able to use it during the lunch and learn. If for whatever reason it's not working or they want to use something else, you should go to plan B at that time and not wait until the lunch to do so, right? And make sure that that primary contact is also the person who's going to be responsible for making sure that the flagging sheet is completed, that the number of attendees who are going to be at the event is communicated in the morning so you can place your order, et cetera. You want to have that one-stop shop. You want to be that one person. So we say if you're not going to have the number of attendees required in the morning, just reschedule that virtual prof-ed. If you don't have the right contact person, if the office doesn't have someone who's tech savvy, organized, can be trusted, we strongly encourage reps to not have the prof-ed event because it's likely that something is going to go wrong and then we're not going to be able to document that we did the prof-ed correctly. So we would rather just, there's plenty of offices out there and plenty of opportunities to have these events. So we don't want to take a risk unnecessarily. Content during the event obviously has to be all the MLR approved content that would be the same as an in-person interaction. We don't have any virtual content that has come through MLR for approval. We ask the rep to either, there's different choices, kind of depends on what that contact person wants. You can have the content mailed, right, maybe overnight mail in advance. So the detail, et cetera, you can print those out and mail them. And this way, at 9 o'clock in the morning, when you have your call with the contact, you can make sure that that's been received. That's kind of very rare that reps want to go that route, but that is an option for them. They could email the materials, and again, in that morning, make sure that the email has been received. Well, finally, if the rep is confident enough in how well they can use the platform, they can just share their screen and go through the detail aids right on their screen during the presentation. In any event, all of these are materials that they've been using prior to the pandemic, and there's nothing different. We don't really make any exceptions to how we conduct the VPE, other than the fact that it's virtual and that the rep isn't there to ensure compliance with the sign-in sheet and so forth. But I'll turn to Seth to see if there are any other exceptions that you think some companies are considering.
No, there's really, again, no exceptions here, with the one caveat of really what's reasonable in terms of being able to ensure that your products are used safely and effectively. And to the extent that the pandemic is interrupting the ability to provide that assurance to patients and providers, there may be reasonable exceptions, which is I would much rather be in a position to defend that we went through everything we needed to do to ensure safety and effectiveness of a product, as opposed to dealing with issues under the anti-kickback statute or the pharma code or AdvaMed code. But you really have to think through carefully how much this is really about safety and effectiveness and how far you've departed from where the traditional avenues are for being able to provide those resources. And I think the most common area where we see that is in meals. And I'll let Sergio talk a little bit more about it, but the issue here is, you have to think carefully about how really important is a meal to safety and effectiveness for the patient.
Quickly, I think you may want to try without the headset because there's static in your headset. So your voice was okay, but there's a lot of static coming from the headset.
Is this better?
Oh, much better. Damn.
Okay. All right. So that was easy. Right. So look, the reason why we do meals, whether it's virtual or whether it is live, is, like we said earlier, not as an inducement to write the product or a thank you. It's because that is when the office is available. They're busy. They're seeing patients nonstop, so they can take a break during lunch or maybe a snack time to have a longer detail and discussion about the product with a sales rep, which, at least in the case of our products, is often 2 minutes in the hallway. The meal allows the physician and the staff to take a break and to listen to a longer discussion and to answer questions. That's the only reason for the discussion. For the meal. So much like prior to the pandemic, the meals have to be in the office, can't be outside the office. So what that means is, if the physician is working from home and doing telemedicine, we don't provide a meal. The only folks who can have a meal are those in the office. So we've had situations where number of physicians in the practice, some are home, some are in the office. The physicians who are at home are welcome to dial into the conference dial-in. to hear the presentation, ask questions, etc., but we don't send them a separate meal to their house. The people who are given the meal are those only in the office. Meals obviously have to be modest and appropriate, no different. Our meal limits that are in all of our training documents, our policies, have not increased. In fact, we make it very clear that with respect to all of our policies, we are, not that we weren't strictly following them before, but we are really making sure that because these virtual meals aren't spelled out in the pharma code, and because what we're doing is we're taking some level of risk, defensible, but a certain level of risk that we weren't taking before, that everything has to be, dotted and crossed and done properly, to the extent that every single VPE that we've done, virtual meal that we've done, is being audited and monitored. So we have compliance professionals, including myself and the folks who work for me. We have our district managers attending them. And then at the end, we every single one, all of the documentation is audited to ensure compliance, the receipts, the sign-in sheets, et cetera, which we don't do normally, right? We monitor a random percentage of our live DPEs, but because of the virtual nature that we're in and the fact that the pharma code doesn't specifically allow them, we're monitoring every single one.
I mean, the issue is, why go through the trouble that that Sergio's team at Osmotica are doing? And when you look at something like meals in the home setting, I think it's a perfect example of what Sergio is talking about here, which is, on one hand, you can make logical assumptions to go from point A to point B to point C, meaning if we would usually allow for a meal at an in-person detailing, then we should certainly be able to allow for a meal when the detailing is the same but occurring in a virtual space. And if that's the case, and the physician would be in the office, what's the difference if the physician is practicing telemedicine from his or her home, and their home is just like their office in this setting? So therefore, we should be able to provide a meal in the home setting as well. And part of the issue here is when you're doing virtual detailing, again, going back to what Sergio said at the beginning, this has to be a situation just like it would have been to the extent that there was no pandemic in place, meaning the purpose of the meal under the pharma code or AdvaMed code is to induce the physician to be able to participate and listen to the detailing that is necessary for the appropriate use of the product. And that means that the meals have come in because, absent being able to provide a meal, the physician or their colleagues may not be able to take their time out of the day from practicing medicine with patients to be able to listen to us. So if the virtual detailing is not happening around lunchtime or dinner time, but happens at 4 o'clock in the afternoon, you'd have to wonder whether it's appropriate to provide a meal in that time that isn't a traditional meal time where the physician is taking a break. If the physician is working from home, even if they are providing traditional services that way via telemedicine instead of from their office, the question is, do they really need the meal from you to be able to interact with your sales reps, as opposed to going down to their kitchen and taking the call or the virtual detailing session from their own kitchen or dining room where they have a refrigerator stocked full of food? Therefore, does the provision of the meal hold up in the pandemic situation? And that really is the analysis we're walking through here.
A quick question from the audience also came in, Sergio. The question is, do you include delivery and service charges during this time of virtual interactions when you're sending meals to physicians or their offices as part of the meal cost?
Yes, we do. And we would prior to the pandemic. I mean, that's part of the fee. We just always include the total amount of the receipt. What we don't do, obviously, what we've had is be careful. Reps have erroneously included themselves in the concur report, right? So because all meals prior to this, they were always in person, the default is to include concur defaults, and most people use concur, but even if you use another one, if you default to have the employee present, the employee has to check themselves off as not present, or you're going to have one too many attendees at all of these events. It's just something to keep in mind. So another thing to think about is documentation. That's why we monitor them, we audit them. My plan is to, if I'm ever forced to explain, what we did during the pandemic, I will have a file on every single event that we conducted, and that file will include obviously all of the information that you would track for Sunshine: name, date, location, etc. But we're also going to, obviously have the sign-in sheet. The rep is responsible for ensuring that every person who is at that event and eats, that there is a sign-in sheet that the point of contact is responsible for sending to the rep. We say try to get it as soon as the event is over. Don't wait, because that's going to find its way into the trash. So get it right away. The receipt, etc. And at the end of the event, the rep has to, I just created this document. It's a one-pager. I just call it an affirmation. The rep has to certify to me in writing with a signature that they conducted this lunch and learn. The people on the sign-in sheet were the ones who were in attendance and participated in the meal, that all the documentation was gathered, and that the discussions were on label, that it was the primary purpose of the event was to have an on-label discussion using MLR approved materials. Just 5 or 6 bullet points, and then they sign it. And so that's sort of the last document that goes into that file. So each one of these events has, a story that's being told. This is what happened, and this is why we did it. Next thing is, you should consider an explanation as to why this is done. And this is that italicized language in here. I won't read the whole thing, but basically what I wanted to do is to have the reps communicate to the physicians why we are doing this. Because the last thing you want is for someone to get the wrong idea, and either a physician or perhaps a competitive, representative or somebody who works there says, hey, this company is now conducting dine and dashes. They're just sending us meals as thank yous, and that's certainly not what we're doing. So we make it very clear at the beginning that the only reason that this is being conducted in a virtual fashion is because of the coronavirus pandemic. That's why we're doing it. And what we've also instructed our best practice is if people are coming and going, and you make the statement in the beginning, and then you see people join the prof ed sort of halfway through, pause and say it again. And we've had some reps who say it even at the end. They just want to keep saying this just to make it clear to the attendees. So that's something to consider. And then finally, when to conduct VPEs and when to not conduct them, that's going to be on a case-by-case basis. It's clearly, as we could see, each state has made their own determination as to what's opening and what's closing. And then within each state, you've got county and local officials making determinations. And finally, you have each individual practice determining whether or not to open. So we say a VPE or virtual meal is permitted when you cannot conduct it because of the pandemic. So that means if the state, county, and local officials have all said things are open, but your one contact says we are not allowing prof eds, we are not allowing meals in the office because we're willing to see patients, but we're not willing to have a gathering with food, then a virtual meal would be acceptable there. We even had a situation or two where an office was open for reps to come in, provide a quick detail and to sample. But again, they did not want a gathering for a meal. So we said in that office, you can go and do your live detail, your sample, and then you could schedule a virtual meal for another time. So it really has to be on a case-by-case basis. All right, so we'll move on to sampling. For us, sampling has remained the same. In the event that you can get into the office, we have reps in certain parts of the country that can get into the office and sample, then your sampling is conducted the same way as you would, again, prior to the pandemic. So sampling rules are generally remaining unchanged. If the office is closed, as many offices are, then an HCP can request for samples. We have different products that are sampled. You go on our website and the physician fills out the form and the samples are delivered by mail. We do not allow for physicians to request samples on a virtual lunch and learn, to just verbally request a sample and then we would submit that. We would fulfill that, right? So that's where we just had to make sure reps were clear. The sampling rules remain the same. If you get a situation where during a virtual meal, a rep says, oh, since I have you, we are out of samples, then the rep is required to instruct the HCP as to how to go to our website and formally request samples in writing, right? Same thing with a patient delivery. There is no different rule. Just because of the pandemic, the HCP submits a written request of that patient, and then we would fulfill that request. Has to be documented. There's no relaxation of any PDMA rule with respect to record keeping. Signatures are required where they're required. We're going to keep records as we've kept them before. But just like anything else, once you get into a something different, which was what we're doing with the virtual world, reps think that maybe other rules have been relaxed or changed, and we just have to make sure that we're clear with them that with regards to sampling, they have not. Speaker programs. So we have not conducted speaker programs virtually, but there really should be a very similar type of approach as to a virtual lunch and learn. What I've always said about speaker programs is you've got so much more control over a speaker program than you do over a lunch and learn that you really shouldn't be non-compliant in any of the rules that govern speaker programs. In a lunch and learn, you have the situation where people are coming and going. You're not sure if they signed the sign-in sheet. You're not sure, did they grab a sandwich and leave or did they not? Speaker programs are much more controlled. So really, this is about making sure that you've got the right technology, you've got the right logistical support to run the speaker program. But at the end of the day, the attendees and the speaker are well known to you. You know who they are, and you should be able to run this seamlessly. Ideally, you have a speaker bureau and a speaker program, you have a third-party company who is responsible for managing it. And they would be responsible, much like you make the point of contact in an office responsible for ensuring compliance with your rules. That third-party vendor would ideally run your speaker program. For a small company, you don't have a third-party vendor, you're going to have to make sure that there is somebody in the company who is going to be responsible for ensuring that the speaker program is run in accordance to all of your policies, right? So you've got the right attendance. We can't have speaker programs, even though we don't run them anymore. We used to, and we will. Actually, we're starting the bureau back up. You got to have a certain number of minimum attendees. Each company is different. Some may say 3, some may say more, but it's certainly not a speaker program if it's a paid speaker and one person on the other end of the line with a meal. So you've got to be able to make sure that you're able to account for every single attendee and that the program that is run has the minimum attendance. Modest meals. So the requirement by the Pharma Code that the meal be modest is not relaxed. You need to make sure that you're working with catering companies or restaurant vendors who are either familiar with working with life science companies and keeping it within the appropriate meal limit, and if not, that your sales rep is clear whether it's a rep or somebody at the home office, is clear that you've got strict meal limits in terms of dollar amounts and that those are followed. And that they are modest with respect to the geographic location of the attendee. So if, and this is really getting into the weeds, but if your speaker is in a high cost area, if they're speaking in San Francisco and you've got a meal limit for San Francisco, but one of your attendees is in Indianapolis and the other one is in Provo, Utah, the meal limit should govern where they're located. The San Francisco meal limit shouldn't apply to everybody, right? So the person who's getting the meal should be getting a modest meal. And then the meal should be during the program. It's incidental. They're not going to, sit through a program and then at the end of the program be delivered, a meal. The meal should be just for the attendee, so that you're not delivering a dinner for the attendee and his or her family, right? So it's one meal, and ensuring that that people aren't over ordering. I always say the meal limit is the meal limit, but it still has to be modest and it still has to be for that individual. So if your dinner guidelines are, say, $125 or $150 for a dinner, you cannot send $125 or $150 worth of food to a person's house and to feed the family, but say, well, I stayed within the meal guidelines, right? So it has to be for that individual.
And the one thing I would add is, in addition to just quantities of the meals, it's important also to consider when you move to a virtual speaker program that the setting is very different. So most companies are often focused on local or regional speaker programs to be able to avoid HCPs having to travel long distances to be able to participate. But of course, once you go virtually and there's no travel involved for anyone, the quantity of speaker events that would be held, even if you're in full mode of operation, would logically be much fewer. They may be aimed at having a couple of different times for attendees to be able to join, but rather than having a speaker program in 15 different cities, a single speaker program with one paid speaker ought to be able to reach the same audience as 15 individual speaker programs identified locally, set up locally on different days. And so you also would want to be mindful as to whether it's commercially reasonable to be having multiple programs on the same topic by different speakers aimed at effectively the same national audience.
Okay, ad boards. So in the interest of time, I'm going to keep things moving along. Ad boards, the thing you need to really worry about is ensure that the contract covers the activity. If the contract requires in-person activity or it requires an amendment, then that you should be working with your legal department to ensure that that's done. We've conducted 4 full ad boards during the pandemic, 2 live, no meals. And the other 2 were conducted on the medical side, and they were done over the course of a week, where questions were posed, and there was a discussion among the ad board members. They could post their reply, they could post questions as well. So either way, whether you do it live or whether you do it in more of a group chat format, you can conduct an ad board much as you would prior to the pandemic. All right, MSL interactions. So MSLs have been used to virtual interactions for quite some time because of the limited numbers of MSLs in relation to the number of sales reps in the field. They're usually very busy, and they certainly can't go and meet every HCP and discuss their question live. So for years now, MSLs have been used to working on FaceTime or some other kind of virtual platform to deal with their HCPs. So I find that MSLs are pretty, they're good at doing this. They know what the rules are. They are aware of the difference between unsolicited requests, for information, which allows for scientific exchange, versus if they reach out to a KOL or a physician, that they then cannot, stray off of the label. We only have a few MSLs, but like I said, I think that they're very well versed in how to conduct virtual interactions with their physician.
Yeah, I think, and again, just the issue that's going to come into play most with MSLs is companies already struggle with the dynamic between when a sales rep and an MSL can be presenting simultaneously, and in a virtual atmosphere, it may be easier to cross the streams than usual and maybe harder to monitor from a compliance perspective, where there may be medical or clinical information simultaneously with sales or promotional information that may create promotional challenges for your company.
So here's some of the considerations. I think we've really hit on a lot of these in our discussions. We didn't talk about recording. We do not record our virtual interactions. We monitor them, but we do not record them. Two schools of thought there. One is, do you want to document this, which is always discoverable, and that's the fact we've taken. We've decided not to, but your company could choose otherwise. There's no, I think, right or wrong answer. It's really a matter of your preference. And we talked about.
And importantly, let me jump in, Sergio. That also goes back to the point you made about the IT selection that you make. So certain platforms, such as Zoom, as an example, allow for attendees to record on their own. And so you need to make sure that if you don't want a recording, that the platform that you're using won't enable recording by third parties as well.
That's a good point. So I think we've only got a few minutes left. Mohammed, do you want to go into field force reentry? Do you want to do Q&A?
Yeah, I'm thinking, because field force reentry is such an important topic, I would rather us continue. I don't know if you, Seth and Sergio, are you able to allocate an additional 10 minutes to elongate the webinar? Because we can certainly send the recording to the folks later. But I would love to conclude the content, because I think it's important for the folks that have joined in and for the ones that are going to get the recording. And Q&A part, there is a few additional questions that have come up. I can certainly ask those later in an email to you both, and then we can circle back to the attendees for the Q&A. So I would prefer to complete the content if you both are comfortable and okay to extend out by another 10 minutes.
That sounds great.
Yep, I'm fine.
Okay, all right, so let's go through that.
We'll do that quickly. And so in terms of moving the field force back out into the field, there's really, frankly, from my perspective, I'm a lawyer, so everything has legal implications. But I would look at first, what the things are, what the boxes are that we have to be able to check in order to be able to do that. And what we've seen already is there's been a number of foot faults or missteps by companies in multiple types of industries. Some of those cases, like those against Amazon and Tyson Foods, for example, have become very public forms of litigation right now. But manufacturers themselves are starting to step into issues as the local guidances are changing now, what seems like this week, on almost a daily basis. So it's important from a legal perspective that as you think about re-engaging your sales force, there really are all three levels to be able to check. So on the federal level, the occupational safety and health rules are really prevailing. And while those don't dictate specifically whether the company can or can't send out personnel, the OSHA requirements are really about whether employees are going to be able to object to being sent out into the field, particularly if things like their compensation and incentives are potentially on the line, or an employee might be terminated if they refuse to go back out because they fear for their safety of going in not just to any workplace, but to a potential workplace where there are likely to be sick patients. And it may be that they have high-risk conditions themselves. It may be that they have young children, older parents, or spouses or family members that are particularly at risk with respect to the virus. And the OSHA rules may allow those individuals to determine that there is an imminent threat or danger to their health or safety by returning to the field, such that blanket efforts to just push all of the field back or all of the field even in a particular state or jurisdiction can raise significant risks for the manufacturer. Similarly, at the state level, each state has different employment protections for employees and to a lesser degree, independent contractors. So those rules are going to need to be navigated not on a single or a national basis, but on a state-by-state thinking in terms of working with your HR department, where are we safe and where aren't we safe to be able to redeploy our personnel. And then specifically at the state level and the local county levels, what are the regulations, orders, and guidances that are in place, not just around things like stay at home that we'll talk about in a moment, but a whole host really of issues here. So mostly what we're seeing is that people who are beginning to think about when to re-engage look first at what is the state of the allowance of business operations. Are people required to stay at home? Are we an essential business? Are we allowed to open and function? And that is certainly the first step. But each of the points enumerated on this slide, including does my sales force need to wear a mask? Do they need to wear gloves? Does the mask need to be an N95 mask, or can it be a cloth mask if they're going into a healthcare provider setting? Do I need to make sure that my employee takes their temperature before they go into these settings? What happens if the healthcare provider is going to ask them to take their temperature before they enter into the office? Is doing that once a day enough? Do they need to do it before they go into each and every potential customer location? Are we going to require our field force employees to take COVID tests? Are we going to use serology or antibody tests? Are we looking for current presence of the disease or presence of antibodies that may indicate that they are or have had the disease or have some immunity to it? What is the effectiveness of the tests that we're using, and how are we representing them to our customers? Are we required to use testing either by our customers or by state or local rules? Or are we doing it of our own volition? And how are we recording that information? What do we do if an employee tests positive, or if an employee indicates that they're not feeling well, has a fever, or has some symptoms of potentially COVID-19 without a firm diagnosis? Are they required to quarantine? Will you be required to notify your customers that the employee has tested positive or has symptoms? What if they've already been to the customer's office or location beforehand? What's the length of the quarantine that we would require? Is that set by state or local jurisdictions? Some of them have 10 days, some of them have 14-day requirements. Your company may have something different. Your customer may have something different. What happens in the environment at the customer location? Is social distancing in place when you're in a physician's office or a hospital? Or are things more relaxed there, given that the HCPs are most likely wearing protective gear such as N95 masks and gloves? How do you social distance effectively in that environment? How many people can be in the same room or the same space at the same time? Does the sales rep need to wait in their car or in the lobby until they're called up? Or can they come in and wait in the waiting room along with patients to be admitted back to see a physician? Importantly, for many field force personnel, they're often traveling between states. And many states and localities right now have restrictions in place saying that if you come into a particular state or locality, The triumvirate right now of New York, New Jersey, and Connecticut, for example, is requiring new entrants into any of those communities to quarantine for 14 days. What happens if you're moving back and forth between two different states on a regular basis for your call? And in order to make a call in the neighboring state, you'd have to wait 14 days before you can get in, when in ordinary circumstances, you might move across state borders to see two different customers within the same day or from one day to the next. And then certainly understanding all of the issues that Sergio was talking about in terms of meals and virtual interactions only become more important when you may have sales reps or other personnel personally delivering or bringing in meals, touching food, touching containers, and worrying about contaminants. The issues, again, for all of these types of risks and questions, and there are many, many more questions right now for companies than there are answers, really come down to these four risk areas, which is, as I mentioned, the OSHA regulations that allow certain protections for the sales reps and employees themselves, who may come back later to say they were forced into going out into the field when they weren't comfortable, or they were forced out into the field where they became sick and or got others in their family or friends sick as a result, as well as these types of employment law issues that can happen under state law. But most importantly, from a legal perspective, one of the things we're looking at is, and these are the things that are often coming up as well in some of the more high-profile litigation that's already hit the waves and the wires, are tort laws, which is, what can a company reasonably expect when it sends personnel out into the field in terms of what happens if our employee ends up either not being a carrier or who is asymptomatic and didn't know that they were sick, but ultimately ends up infecting others, particularly in medical settings where patients may be vulnerable or doctors who may be treating patients get sick? Are you likely to get a lawsuit from a patient or a provider suggesting that you didn't follow specific rules or procedures and were reckless in some manner in terms of getting them sick? Or vice versa, for family members, friends, and others of the employee who may also have rights, again, against the company to the extent that employees out in the field are going into medical facilities without proper protective equipment and are coming back and infecting others. And those are two different types of potential tort liabilities that could create significant legal risks for manufacturers and that really need to be considered in the face of all of these questions that we're looking through right now. One of the challenges is, certainly it's not just about the law too, it's about your customers. And as we said from the outset, each of your customers is looking at this in a different way and has their own different set of implementation rules, requirements, such that you may be offending your customers, certainly if you get someone sick, but maybe if you don't follow their rules as well. And how is sending people out into the field going to impact your ongoing customer relationships? So the rules are really unclear. The risks are often considerably high. And one of the biggest challenges that we've identified is there are no single resources out there at all right now to be able to look at and identify all of these risks and challenges and be able to protect yourself as you send employees out. Companies are having to go to individual websites of states and localities and one by one do checking. At King & Spalding right now, we're trying to assemble a group of manufacturers to pool their resources together to be able to develop a tool or a checklist to be able to manage all of these questions, to facilitate the decision-making of companies. But most of all, we're recommending that companies be able to have the right types of documentation so that if you run into one of these types of risks, the company can best protect itself as you move forward. Ultimately, I want to end, of course, with some proactive guidance for you. And so you need to be able to identify tools or mechanisms of the type we're talking about to be able to make sure you can check the box so that employees going out into the field at least have met all of the federal, state, and local laws, and likely those of your customers as well, to be able to demonstrate that you've taken reasonable steps to protect the public, patients, your customers, and your employees. And then as compliance and legal professionals, we need to figure out how can we monitor these activities. You're not going to have ride-alongs. To what degree can you accept employee certifications? Employees rarely use CRMs effectively, but can that be used as a tool to be able to identify that that employees are taking all of the necessary steps? How are they going to communicate, or how is the company going to communicate with your customers to make sure that we understand what the customer rules are and our employees going out into the field are aware of them? And what resources can your company provide to be able to back up your employees out in the field, such as helplines, HR availability, compliance assistance, and MSL support? Making sure that the virtual avenues are being open to your employees will best help to make sure that you don't have people who are making decisions on the spot that may not be in line with the risk profile that your company wants to take. So ultimately, we're looking at sort of the summary here, which is, again, you may be really needed when it's least expected. And this is not necessarily the environment where people are looking to legal and compliance in terms of managing day-to-day activities within the pandemic. But certainly, compliance and legal personnel have opportunities to be heroes in this kind of environment. So let me turn it back to Mohammed to either address any Q&A or wrap us up.
Thank you so much, Seth and Sergio. I think we're already 12 minutes over. So with respect, I want to respect your time. I don't want to, there is additional questions, but I think it'll be useful if I send them over to you folks in an email, and then we can certainly get responses back to our attendees. So just, I think, thank you for all the information. I think both the topics around virtual interactions and then returning to the field are key and important conversations for our customers and the industry in general. So really, really appreciate you, Seth and Sergio, putting this together and preparing for it and delivering a phenomenal, very, very value-packed webinar for us today. As I said, I'll take these questions, I'll circle them back to you. I'll have my team reach out to you for clarity on those questions. And then for the folks that asked those questions, we'll get back to them with the responses. So appreciate the time, appreciate the content, and just want to say thank you, and thank you to everyone that attended as well.
Take care.
Thank you.
All right, perfect. Thank you, bye-bye.